Hi, my name's Anna. I'll be your provider today. I've washed my hands. I put on gloves. Is it okay that I assess you?
Yes.
First, I'm going to assess for jugular vein distension. I'm going to have you tilt your head back and to the left. Back and to the right. No jugular vein distension noted. At this point, you would look for a point of maximal impulse, which I would ask him to take off his shirt, but we're not going to do that right now. If you are looking for a PMI, you will notice, or you'll look for pulsations in the chest. Next, I will measure my jugular vein distension. I would have a ruler, and I would ask him to tilt his head, and I would have a ruler going up and going sideways. It'd be approximately 4 centimeters, and we would do both sides. Anything greater than 4 centimeters would indicate jugular vein distension, which could indicate fluid overload, which is something that you need to be aware of when dealing with patients. Next, you will palpate the point of maximal impulse. You'll go here and palpate. His is palpable. If it was not, then later on in the assessment, you would percuss to determine if there was dullness in the cardiac area. Next, we will palpate pulmonic and aortic areas. This is aortic. On over is pulmonic. All areas are palpable. Next, we will palpate the carotids, excuse me. Carotids are +2. Number is noted. Next, I will listen to the carotids. Hold your breath. Perfect answer. Hold your breath. Number is noted. Next, you will listen to the aortic and pulmonic areas of the heart. S1 and S2 are noted, no murmur is noted. You'll then take the bell of the stethoscope and listen along the sternal border to notice if there is any areas that would have a murmur. Let's say I do find a murmur, I'd ask the patient to lay on their left side, and then I would then again listen for a murmur. In this case, there is no murmur noted, so that is not appropriate. Can I have you lean forward? We will again listen to the patient. S1, S2 are noted, no murmur detected. I'm just going to listen to your heart. Patient's heart rate is roughly 85 beats per minute. The rate is regular. There are no murmurs noted. S1 and S2 are appropriately auscultated with no other